All right, a little further inland in Massachusetts, there's a new report on the health care status in the Bay State, and it's getting attention today as a possible sign of things to come with the national health care overhaul. New surveys reveal that 53% of family physicians in the Bay State are not taking any new patients. And the average wait for an appointment is now 36 days, with some appointments taking as long as 45 days. That's a week longer than the wait time reported in the 2010 survey. Now, remember, this is the state that was held up as a model for the president's big health care overhaul project. So what's going wrong? Well, Dr. Mark Siegel is a member of our Fox News Medical A-team and the author of The Inner Pulse, and he joins me now. Doctor, great to see you.
Hi, Allison. Good to see you.
So we looked to Massachusetts because it was supposed to be a shining star of universal health care, but obviously it's plagued with some problems. What does this new survey tell us?
We doctors call this a bad prognostic sign. In other words, the state of Massachusetts, which basically said everyone's entitled to insurance, made sure everyone got insurance, but didn't consider that if you had insurance, you might not be able to get a doctor to take care of you. Because I'll tell you a secret, it's easier for doctors to take care of patients they already have in their practice. So we're finding 50% of internists and family practitioners aren't taking new patients, aren't working with Medicaid, aren't working with Commonwealth Care, which is the state's funded program for impoverished patients. That's one problem. The other problem is if you have a doctor, you can't get in to see them. The same survey from the Massachusetts Medical Society found OBGYNs, gastroenterologists, cardiologists, orthopedists, those that are high-intensity professions where there's a lot of effort involved, have long waits. You know, and I wrote in my book, The Inner Pulse, about how medicine is really a one-on-one event. It's about intense care. That's how you get to the real solutions. But in Massachusetts, doctors aren't able to do that. They're hamstrung, and patients are going to the emergency room.
Is that what's happening? For all these patients, obviously, who can't wait 45 days, they just go right to the emergency room?
Because you got the insurance, they'll take it in the emergency room, but if you can't get in to see a doctor. So again, insurance doesn't give you health care. It doesn't equal health care. It's a card. It's only good if you have the doctors available to take care of you. I see this happening nationwide, and I'll tell you why. Because there's an overuse syndrome. If you have an insurance card and it says you can go in with a common cold, then the offices get clogged up with people with common colds. Easier for us doctors to take care of. Somebody's really sick, they can't get in.
But it sounds like you're saying that the alternative is you have to weed some people out of the system, so don't give them insurance. That's not a good answer either.
It's not my solution. What I would do is I would have taken a much harder look at higher deductible insurance with health savings accounts instead of shrinking health savings accounts where you get a tax deduction or some kind of tax break if you pay out of pocket. That's a disincentive for overuse, Allison. If you have to pay yourself, you're more likely to go if you're really sick. I think the middle class could have done with something like that. Instead, it's being shrunk. Again, the kind of insurance over the health reform law is the kind where you have low copay, low deductible, easy to get in, but you try to get in, there isn't a doctor. Very concerned about the Massachusetts Medical Society finding that this applies to specialists too. We knew this was a problem with family docs and with internists like me. But orthopedists, OBGYNs, you can't get somebody to deliver your baby? That's bad news.
That is bad news. So you think that what's going on in Massachusetts, by definition, will happen nationally now that we have this new healthcare overhaul?
There's no question about it. In fact, I think it's going to be even more of a problem nationwide because Massachusetts, we all know, has Harvard University, has Boston University, has Tufts University. They're loaded with doctors. If they've got a shortage, what's going to happen in North Dakota?
But having said that, you know, this is also a problem in Manhattan, in New York City, where we don't have the same healthcare system that Massachusetts has, and you still have a long wait to get to see your doctor. And many doctors here don't take insurance. So this was a bubbling problem even without universal health care. You
are totally right. To be fair, this already was a problem. But how did we fix it? By not even recognizing it. We weren't taking Medicaid here. A lot of doctors here are running from Medicare. So how does extending that to more and more people help the system? It wasn't really looked at. We have a doctor shortage, a doctor disgruntlement problem, a doctor overwork problem, and as this survey also points out, a lot of medical students don't want to go into primary care because of all of this burden of too many patients.
Right. I mean, we really need more doctors.
More doctors, more primary care doctors, and more doctors that are not overworked. I'm not overworked, but other people are.
I can't believe you're not overworked because I see you working all the time.
Well, I'm a workaholic, but not everybody is. Some people want to go home at night.
Strange. All right. Well, Dr. Siegel, thanks so much for that warning. And again, Dr. Siegel is the author of The Inner Pulse, and we should say you predicted this before the Massachusetts Medical Society ever did. You've had your finger on the pulse, no pun intended.
Thanks, Allison. Thanks.